It's time for our COVID conversation this week with Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Good morning again, Dr. Bogoch. I know we talked lottery, now we'll talk health. So let's start here. We've talked about this, and I saw you even on CP24 over the weekend talking about this. Some Ontario hospitals are dropping their masking protocols. So what are the dangers here, and how worried are you that this could lead to more cases, especially among vulnerable people who are already in hospital?
Yeah, so a couple of key points here. For starters, there are policy changes that are happening in Ontario hospitals, and in fact, this is really something that's happening in hospitals all over Canada, United States, and other parts of the world. Second point is that, yeah, of course, we have to acknowledge that there are very vulnerable people in hospitals, and many of these individuals are at greater risk for more severe manifestations of the virus. If we look at what's actually happening in Ontario, and I'm not going to speak on behalf of any particular hospital or pretend to know what's happening in every hospital in Ontario, but in general, the masking rules are being lifted in some parts of the hospital, but are being maintained in parts of the hospital where there's patient encounters. So in clinical settings, it appears that most, if not all, but certainly most hospitals are going to maintain masking. And obviously, that's important to protect the health and safety of patients who are vulnerable.
Absolutely. And masking sort of ties into this next question as well, Dr. Bogoch, because you pointed out on Twitter that COVID-related hospitalizations in Ontario, they continue to come down. But those who are hospitalized are overwhelmingly older, medically vulnerable. So what can we glean then from this data, and how does it really tie into people who are in hospital? And I know we've talked about this before, admitted with COVID versus getting COVID in hospital.
Right. I mean, there certainly are outbreaks of infectious diseases in hospital. We have flu outbreaks. We have RSV outbreaks. Sadly, now, as of 2020, we've had COVID outbreaks in hospital. This is something that's going to, unfortunately, we're going to have to contend with for the foreseeable future. And anytime there's a hospital outbreak, there's dedicated infection prevention and control teams that, well, for starters, they do their best to prevent outbreaks from happening. And when there is an outbreak, they swoop in, they try to quell this outbreak as quickly as they possibly can. We know that the severity of COVID, for example, in hospitalized patients in the midst of an outbreak, the severity of infection has actually gone down. So if you look at things like case fatality rates, those have remarkably declined over the course of the pandemic, thankfully due to vaccination and therapeutics. But again, like at the end of the day, we have to protect our most vulnerable. That includes people who are in hospital. We want to avoid COVID infections, and we need to be taking steps to avoid COVID infections in all settings, not just hospital settings.
Yeah, indeed. And that's a point you've highlighted many, many times over the last several years, Dr. Bogoch. You've also recently highlighted on Twitter that there are measles cases in Canada now, and that we'll be seeing more of it. You're also talking about it's a two-dose vaccine. Some people may not know that. And you're also pointing out that too many Canadians are either unvaccinated or under-vaccinated. So A, how do we go about this? And B, you were sort of pointing to an area you can go where you can sort of find out what your immunity level kind of is. I think that's important for people to know and understand.
Yeah, so for starters, I mean, there's a lot of measles around the world, and we certainly will import cases of measles here in Canada. We really need to have high levels of vaccination in the country to prevent outbreaks of measles here. And this is probably one of the most contagious infections on the planet, and it is completely avoidable. It is completely preventable. There's no reason to have any outbreaks here in Canada. The vaccine is safe and it's very effective. Now, many people might not know this, but they might not be fully vaccinated to measles, especially for people who are in the Generation X age group. Many of those individuals may have only received one dose of the measles vaccine, and they are not averse to getting a vaccine, but they just might not know that they might need a second dose of a vaccine. There's a web page on the Public Health Agency of Canada that really that can tell you, who would need a measles vaccine, how many you should get. But in general, this is a two-dose vaccine. Most Canadians are vaccinated. Some people might be under-vaccinated and they don't know it yet. Simple thing to do, go talk to your family physician, go check your vaccine card. I appreciate it's, not everyone has a family physician, and it's hard to get in touch with a family physician these days in much of Canada, but you can speak to a pharmacist or a public health clinic. There's lots of healthcare providers around who can help walk you through this, but it's very important to be up to date on your vaccination.
Yeah, good ways to find out, and of course, keep yourself safe and protected. Okay, Dr. Isaac Bogoch, that wraps it up for this morning. Thanks so much for being here. We'll talk soon. Thank you.
Have a great one. Thank you.
And you.